Hi everyone, my name is Morgan Fleming, and my project is The Paramount Duty of the State, an analysis of Washington State education budget reform. So I wrote a research paper about a 2013 Washington State education budget bill that increased the K-12 budget by almost $1 billion, and was supposed to be allocated to specific categories like decreasing early education class sizes, different transportation systems, and increasing full-day kindergarten enrollment, especially in high-poverty districts. The state passed the budget increase in response to a Supreme Court ruling that said the K-12 budget did not meet the standards set by the state constitution for equitable education. And actually, many states have had similar court-ordered budget reforms. And the studies have found a positive result in various student outcomes like test scores and graduation rates. They found that these policies were very effective at increasing student outcomes when the funding was distributed very generally across all districts. However, since this Washington State policy was targeted at a very few specific programs, I wanted to see if the money actually ended up where it's supposed to, if it was allocated properly. I actually had per pupil funding data for each of the funding categories that the bill was supposed to target. And with that data, I was able to use an interesting statistical technique called difference in differences, which is basically supposed to replicate lab conditions like you're in a chemistry lab with a treatment group and a control group. And interestingly, I found that the money did not actually flow as it was intended. There was no per pupil increase in the targeted categories. And generally, this can indicate that these kind of hyper-targeted or very specific policies are not as effective as lawmakers may think that they are. Thank you.
Hello, my name is Elizabeth Bakhnov, and before I get started, can I just have a show of hands of who here hates going to the dentist? That's what I thought. In fact, you are not alone. About 36% of people in the United States have a fear of the dentist. However, when this general unpleasantness and discomfort that we all feel turns into extreme fear and avoidance of the dentist, it can be diagnosed as dental anxiety, which is considered a specific phobic disorder by the American Psychological Association. As a pre-dental student who minors in psychology, the high prevalence and lackluster research on dental anxiety made me wonder what underlying demographics could cause it and what can be done to increase the number of anxious patients seeking out the dental care that they need. So, for my Keystone project, with the help of my amazing advisor, Dr. Mela Goldner, I distributed a survey to patients at a local dental office. The survey collected their demographic data, asked them to self-report their oral health levels, and also measured their dental anxiety levels on a scale. I then took their dental anxiety levels and I compared them to their demographics, and I found higher anxiety levels in patients who had negative previous experiences with dentists, had higher levels of pain and discomfort, and in patients who had state-funded insurance as opposed to private insurance. These results point to a need in the improvement in how some dentists treat their patients in order to decrease the number of negative experiences that their patients have that could increase their anxiety in the future. Also, these results support the well-known facts that access to affordable healthcare in the United States is an ongoing issue. As a future dentist, I hope to take what I learned from this project to educate myself and my colleagues on how to decrease anxiety levels in our patients and increase the number of people seeking out the dental care that they need. Thank you.
Hi everyone, I'm Mutka, and my project is visualizing connections between watershed health and neighborhood wealth. So watersheds are areas of land where all of the water that flows in each one, or that falls in each one, ends up flowing to the same place. And they provide an organized way of studying where healthier or unhealthier ecosystems are located by taking large areas of land and breaking them down into smaller pieces that can be easily compared. So by studying them in relation to localized wealth, it becomes possible to see where and what kinds of communities are able to enjoy the many benefits that healthy watersheds can provide, which include clean drinking water, habitat for wildlife, and recreation opportunities. So for my project, in order to research the relationship between these two factors, I ended up conducting both statistical and spatial analyses, meaning that in addition to looking at this in a more traditional way, I also ended up creating a series of original maps using pre-existing watershed health index data and average personal income by county data. Through this, I've been able to identify the main patterns in where healthier or unhealthier and more or less wealthy areas tend to overlap along the East Coast in the United States, where unhealthier watersheds tend to be clustered around cities, and unlike most environmental issues, have a negative relationship with neighborhood wealth, meaning that more wealthy areas tend to have unhealthier watersheds. Finally, I will have some copies of my final deliverable, which include my maps, explanations, and other resources available for anyone who's interested. Thank you all for being here.
My name is Matthew, and so my Keystone is the post-COVID-19 vaccine booster confidence in Recife, Pernambuco. And no, it's a mouthful. So I'm sure over the course of 2020 to 2023, we've already heard more than enough about COVID. And so I wanted to give a little bit more of a nuanced conversation about a region that you might not have heard of. So in Brazil, it was the second most impacted country in terms of deaths when it comes to COVID. Paradoxically, Brazil also had one of the highest vaccination rates overall. And so now that the pandemic is over, as of May 11th, 2023, I wanted to look at a sort of view over the boosters, how people are perceiving the boosters, how people generally want to take them, and also associate that with political ideology. In general, my region of Brazil is severely underfunded when it comes to academia. So this region is what I consider to be my second home. And so it's very gorgeous, as you can see, with this beautiful coastal line. But when most people think of Brazil, they only think of Rio de Janeiro or São Paulo. And those are the only two areas that the academic community, even in Brazil and the world at large, really cares about. So this gives me a little bit of insight over the general scope of everything. And then also, along with a lit review, I actually flew to Brazil and decided to interview a couple doctors and discuss various different metrics that they perceive that their patient population believes. And this gives an overall good picture of whether or not the COVID vaccine is really being advertised as a valid and useful method to prevent further COVID spread. Thank you.
Good morning, everyone. My name is Adebogun, and my project was called The News Media Black Box, Media's Relationship with Police Brutality Protests in America. I would like to dedicate this project to all victims of police violence that we've seen in the last however many decades. They all deserve to be here today, so I encourage you to look into their stories, say their names, and appreciate each and every one of them, regardless of what the media actually puts out. So that's actually kind of the inspiration for this project. I was inspired by a few cases that I saw in the media last year, and some things that stood out to me were the way the media kind of tended to different cases depending on a few different factors, such as the victim's race, their armed status, as in whether they were wielding a weapon or not, as well as whether there was body camera footage readily available to the public. And so I performed a headline analysis of media coverage for 14 different victims, specifically white and black victims, as well as only male victims for the scope of this study, to essentially look at what the effects of a victim's race, armed status, and body camera footage availability had on the amount of coverage that they were receiving, and more than that, whether that helped to facilitate protests specifically in their name. I ended up finding some really interesting trends that I look forward to sharing with all of you when I present my poster shortly. But I found that there was a significant impact about a victim's race and armed status on whether they received a lot of media coverage and whether that coverage led to protest. And I found that body camera footage availability also was something that would help to catalyze protests in someone's name, sometimes even more than once. The overall purpose of this study was to kind of shed light on exactly what factors can help victims of police violence be actually mentioned in the media, what it looks like to have equitable media for different victims to ensure that we don't have victims who we never hear of, whose names never hit media headlines, and also to encourage us as civil advocates to be able to stand up and take opinions and take action for people regardless of what we may see in the media in terms of bias. So I look forward to presenting, and I'd like to also thank my advisor, Dr. Catherine Levine Einstein, for all her help on this project so far. Thank you.